A stem cell is this very basic cell that all of us have. They're called undifferentiated cells that can then become specified cells. So those little basic cells can then become heart cells, they can become liver cells, they can become whatever, skin cells. Stem cells in and of themselves act to repair our body. So they really start to form in very basic terms. They start forming tissue and organs and so forth, and then also can help to act as our repair system. So they're also called, without getting too sciencey here, they're also called autologous cells. So in other words, if you can kind of think of something along those lines, is if you were going in for a surgery and say you wanted to have your own blood, in the case of you needed to have a blood transfusion, you could have your own blood taken from your body before surgery and then transfused into yourself once that time comes. So there are two basic types of stem cells. One is called hematopoietic stem cells and the other is called mesenchymal stem cells. So these hematopoietic stem cells are blood forming. The beginning part, heme, which means blood in Latin. And so those types of stem cells are primarily used to treat patients who, say, have blood-based cancers or leukemia or something like that. Then there's mesenchymal stem cells, which are related to treat tissue and organs. They can help to regenerate, say, your eyes, bones, nerves, lungs, cartilage, heart, skin cells, muscles, and so forth. So you're thinking to yourself, what does this have to do with dentistry? Well, what it has to do with is, so stem cells, you kind of hear all this new discussion about stem cells. Nobody really knows the general public, I should say, doesn't really know a whole lot about them, except when you're going to have a baby. You're oftentimes given a little bit of education about this before childbirth, where you're given the chance to say, they'll say, do you want to preserve the umbilical cord of your baby? Yes, no, and why would you want to do so? So there's this tissue that's preserved. There's the blood that's in the umbilical cord and then the tissue of the umbilical cord itself. Now, science very, very, very recently has brought about where you can actually preserve a tooth. So let's say for example you have children who are going to lose their baby teeth, or maybe you have a teenager who has a wisdom tooth that needs to come out. You can now preserve that wisdom tooth, and remember I was talking about those mesenchymal stem cells? Those are found in huge numbers inside the pulp of a tooth. So this is very, very, very new, and I'm one of the first practices really in America to offer this service, where what can happen is you can have a tooth extracted. Now the tooth has to be healthy, it can't be infected, it can't be decayed, it can't be with broken roots or something like that. You can have a tooth extracted. It's then sent to this company that's listed here on this card that I've passed around that's called Vault, and it's frozen cryogenically in Atlanta for your future or for the future of that patient. So should something come about, that again, the stem cells found in that tooth have that mesenchymal type stem cells, which are great for regenerating tissue and bone and so forth.